YouTube followers. I'm here at Dr. Scott Alexander's office, and I wanted to have him talk about the procedure and how it went. And here you guys go, Dr. Scott Alexander.
I'm glad to be here with you today. Roman's been a really great patient. It's been good to see his progress and how everything has gone so well for him. Basically, he went to a national chain first, and he wanted me to discuss a little bit about the differences between national chains and having a procedure by someone like me. These procedures are very technically demanding. You have to be very sure that you are pay attention to all the tiniest details along the way. And when national chains do this, they are interested mostly in the bottom line. So there is no way they can worry about the details that it takes to do a really fine procedure. So they have a time constraint. They need to hurry through these things. So you get a lot of problems when you go to national chains. The biggest problem is low density transplants with a lot of scarring taking place because the blades they use to make the little incisions where the hairs go are too large. So the problem with getting a patient like Roman, who had already had a procedure, is the scarring is already there. So we're limited on what we can do and how well it's going to turn out because we're now transplanting into scar tissue versus a pristine environment. But he has done very well and is really thrilled with the procedure. The reason why is because we do very tiny slits where the hairs go. These slits are under a millimeter. So we place them extremely close together, placing up to 50 to 60 hair follicles per square centimeter. And in doing that, we're able to get a decent density. Now, his density is very early, but is doing very well so far. He, at present, is really happy with the coverage, and we're going to get a video or show you that here shortly. But we do very high density, place these and try to take a lot of care in our handling of the grafts so that they will not be damaged at all and that they'll bounce back and grow quickly. We also use a product called A-Cell. A-Cell is a product that's fairly new out there. We use it because they've been using it in trauma to help patients who are struggling to heal wounds. This product will help them heal quickly. So it's been converted kind of off market into hair transplants. And what we do is we take the product, we dip the grafts into the A-cell right before we implant them. And by doing this, it helps the grafts themselves recover from the surgery and grow stronger, better, quicker. And I think with Roman, it's been demonstrated that he's getting a really good result compared to what he had before. And I'm sure you all have been following him and have seen what he had to begin with. So we're really grateful and thankful for the results that has happened now. But the reason you get these results is because all along the way, each step, we've taken a lot of care and try to make it to where we get these kind of results. And it's something that needs to be a lot of attention needs to be paid to this all along the way. And the other thing that we like to do is strive for really natural looking hairlines. This is done by drawing. We sketch in our hairlines. We try to make it look as natural as possible. I have an art background, so I like to draw them in as opposed to typically most hair transplant facilities will just do a half semicircle that they follow, and we don't like to do that. We like to sketch it in. And you can see it right now. It looks very natural and normal. So for the first time, Roman, it's been that you've been able to spike your hair in a long time.
Oh yeah.
And so today he's come with it spiked and he's pretty happy about that. So the biggest thing for understanding good hair transplants would be probably to go to my website where you can go step by step and see photos and understand how it's done better, which I would suggest to do. It's builtmoresurgical.com. You can go there and look at the before and afters and also the blades and why we push these kind of things so heavily. But we're really grateful with the results that he's getting. They're very early on. These procedures usually take a good 9 to 12 months to look really good. So he has a lot of growth left to see, and it'll just keep getting better and better down the road. So let's take a look at Roman's hair, and we'll kind of show you. So we'll just come in on here, and you can see it's blending in really nicely as it comes in here. The hairline itself looks very natural and normal, and that's because on the front of the hairline we do all one hair follicle grafts, and as it comes around, so I don't know if you're getting it that good on this phone, but hopefully you can see this. So by doing the one hairs, it doesn't look pluggy anymore. It looks very natural and normal. And as it heals, you won't see any scarring at all where the hairs are coming out as he had before with the other grafts. And as it continues to heal and grow stronger, it'll blend perfectly in with the rest of the hair that he has. So it'll just keep looking better and better. So that's a pretty good shot at it, and this is extremely early, so we're really happy with the results so far. So Roman, do you have anything else you want to say here?
I am very thrilled, and thank you very much, Dr. Alexander, for giving me an awesome result. You're not there to take people's money, you're there to give them their life back, their appearance, and you're there to help people, and I'm very thankful for that. And honestly, I feel so great. Whenever I jump in the pool or anything, I don't have to really worry about my hair anymore. And I am just so grateful. I would come back anytime if I lost further hair down the road in my 30s or 40s, even despite being on finasteride. I wouldn't ever hesitate coming back in, and I would recommend anyone to come in and get a consultation with Dr. Alexander. He's a great guy, and I think he's honestly the best of the best. I mean, just look at this, speaks for itself. It's at 5 months, and I'm not getting paid to say this. This is all me being honest, and I can't thank him enough. It's awesome.